Alright guys, last example on how to better utilize this floss tape from LudyFTS.com. So we're talking about the gearing ratio. That's pretty much the ratio of the muscle contracting from the tendon. Sometimes when that ratio is too high, the muscle contracts quicker and pulls away from the tendon and you get kind of a strain. So when rehabbing, one of the ways that we combat that, decreasing that ratio so we don't have that high gearing, is we compress the muscle to kind of give it a slower contraction rate to basically kind of slow that gearing ratio down and not have such a pull from the tendon, so there's no additional strain. So basically we're using a gastroc example. So I would always start with an isometric contraction because that's going to be your safest bet in terms of not moving the tendon a whole lot, but still getting that muscle to contract. So again, you can do this against the wall. So if your foot's against the wall, just for video's sake, I'm going to use the band and say the band's a wall. So I'm going to get some pretty good tension, and what I'm going to do is just get that into a slight stretch, and then what I'm going to do is I'm just going to again contract as if it's an isometric contraction. So I'm contracting into that band, and again I want the knee bent so we can aim for the gastroc. Should be knee straight so we can aim for the gastroc. If we wanted more of the soleus, the knee would be bent. So I'm just holding that and then relaxing, and then again I'm contracting and relaxing, contracting, relaxing, and again I'm trying to actually contract rather quickly into that band once I do it, so I can feel the pull or feel the contraction of that gastroc. And again, you want to make sure you're driving the big toe as much. Again, not trying to move the band. Imagine there's a wall there. Okay, so that's exercise 1 for isometrics. Exercise 2, what I would do is I would start with eccentrics. So I'd bring that into a stretch, and then I would slowly, stretch, now I'm just loading that tissue and an eccentric movement only. And then once I've done that, then I'm going to go into concentric only. So I'm going to give it some slight tension, and I'm going to drive and relax. Boom. Drive and relax. Boom and relax. Boom and relax. Good. So isometric, eccentric, concentric only. That can take up to a period of 4 weeks, a month to develop if you're doing it multiple times a week of isometric. Then the next week move to eccentric, then the next week move to concentric only. After you've done those 3, then I would go through full short stretch tightening,